Welcome to the Rummage Report for May 1st, 2026. Today's topic is Obamacare enrollment drops sharply amid rising costs. Sam Balance kicks us off today.
Hey everyone! So, I just read that enrollment in Obamacare has dropped by over 1.2 million this year, the first decline we've seen since 2020. A big part of this is the end of those enhanced COVID-era premium subsidies, which means premiums are spiking, averaging a 26% increase overall. For many families, that means they could see their annual premiums double from about $888 to nearly $1,904. That's a hefty hit, especially for middle-income families who are already juggling rising costs for everything from groceries to rent. This drop isn't just a number. It means over 1 million people could lose coverage, which puts more pressure on emergency rooms and raises healthcare costs for everyone. Small businesses, like local shops and farms, are also feeling the pinch as they struggle to provide affordable insurance for their employees. We're looking at a potential $300 billion burden across the nation, which is no small change. So, with Congress letting those subsidies lapse, it feels like families are being forced to choose between healthcare and other essentials. Casey, Jordan, what do you think about this situation?
Sam, you're spot on about the real-life implications of these enrollment drops. We're not just talking about numbers. We're talking about families like the single mom in Ohio who's now faced with a choice between paying for health coverage or putting food on the table. When premiums skyrocket to nearly $2,000 a year, many will opt out of insurance altogether, leading to worse health outcomes and more emergency room visits, which ultimately drives up costs for everyone. This isn't just a policy failure, it's a personal crisis for millions. The decision to let those subsidies expire is a direct attack on working families, and we need to demand Congress fix this. They should reinstate those subsidies to protect the most vulnerable among us.
Sam, you're absolutely right about the financial strain this puts on families. It's not just about health insurance, it's about real choices people have to make every day. When premiums nearly double, families have to decide whether to keep health coverage or pay for essentials like groceries and rent. And let's not forget about small business owners, many of whom are already squeezed by inflation, who now face skyrocketing costs to provide health insurance for their employees. If we don't address this, we risk more people falling into the uninsured category, which ultimately drives up costs for everyone as emergency rooms get overwhelmed. We need to bring back those subsidies or find a better solution that actually works for working families.
The enrollment drop is a serious issue, but let's not overlook the broader implications for the healthcare market. If these premium hikes continue, we might see a rise in underinsurance, where people carry policies with high deductibles and out-of-pocket costs, leading to a false sense of security. Families might think they're covered, but end up bankrupting themselves when they need care. This could push more people into relying on emergency services, which raises costs across the board. It's a vicious cycle that Congress needs to address, and we need real solutions that go beyond just reinstating subsidies. Sam, you bring up an essential point about the risk of underinsurance. It's not just about losing coverage. It's about families feeling trapped in a system that's supposed to protect them. Think about the young dad working 2 jobs to make ends meet for his kids. If he thinks he's covered but has a high deductible, he might skip necessary medical visits, leading to worse health issues down the road. This isn't hypothetical. Data shows that people without access to preventive care are more likely to face severe health crises, which ultimately costs us all more in emergency care and lost productivity. We need to push Congress not just to reinstate those subsidies, but also to consider a more comprehensive approach, like a public option that could truly make healthcare affordable for everyone, especially for those in vulnerable communities.
Jordan, you're spot on about the need for preventive care. We also need to think about the long-term consequences of this enrollment drop. Many families who are opting out of coverage might not realize that without insurance, they're not just risking their health, they're also jeopardizing their financial future. A single emergency can lead to crippling debt, and we're already seeing that reflected in rising bankruptcy rates due to medical debt. If Congress doesn't act quickly to address this situation, we could be facing a healthcare crisis that hits our most vulnerable communities the hardest. It's not just about policy. It's about the real lives affected by these decisions.
The conversation. Casey, Sam, and Jordan discuss the recent drop in Obamacare enrollment due to the end of enhanced COVID-era premium subsidies, highlighting the significant financial impact on families and small businesses. They all agreed that rising premiums are forcing many families to choose between health insurance and basic necessities. However, they disagreed on the broader implications and solutions. While Jordan and Casey emphasized the urgent need to reinstate subsidies and protect the vulnerable, Sam warned of the risks of underinsurance and advocated for more comprehensive solutions beyond just restoring subsidies, like a public option. Worth thinking about. If reinstating subsidies is not a sustainable solution, what alternative approaches could effectively lower healthcare costs and ensure coverage for vulnerable populations? How should policymakers balance the need for affordable healthcare with the potential long-term consequences of underinsurance, especially regarding personal financial stability and public health? Considering the healthcare market's complexities, how can we create a system that incentivizes preventive care while still providing immediate assistance to those in financial distress? If you asked me, and remember, I'm a raccoon, I'd say it's a bit like rummaging through trash. You can find some good stuff, but it's a messy situation that needs a serious cleanup.